And the first item on tonight's agenda is a public hearing to consider a proposed local law number 7 of 2021 to either opt in or opt out of that portion of the New York State Marijuana Regulation and Taxation Act, the MRTA. As Karen reminded all of you, you'll have 5 minutes to speak. And I do have a list in front of me. I know that some have come in late and your name is not on the list. We're going to call everyone in order, and then I'll get to those who've not signed in afterwards. Okay. Janine Sanger is first on the list.
Thanks.
Janine. And we'll need your name and address when you get to your vote.
Good evening. My name is Janine Sanger. I live at 822 Tinker Tavern Road. I am the Executive Director of the Webster Health and Education Network. And the Webster Health and Education Network was established in 1995 and is a recognized leader in the advocacy and promotion of healthy, substance-free behaviors and lifestyles in the Webster community. WEN has always worked closely with the Webster Central School District, town, and community resources to support drug education and awareness initiatives. In 2018, WEN joined the Community Anti-Drug Coalitions of America, or CADCA. In December of 2019, we applied for and were awarded a federal grant by the White House Office of National Drug Control Policy, or ONDCP, and the $625,000 grant received over 5 years will be used to involve and engage our community to empower Webster kids to grow up strong and substance-free. That is our vision, and it drives everything we do on behalf of the young people of Webster. WEN is comprised of over 65 members representing multiple sectors of our community, including business owners, school district, faith-based organizations, youth, civic and volunteer groups, media, law enforcement, healthcare providers, substance use prevention, and substance use prevention professionals. Research suggests that the longer youth wait to use drugs and/or alcohol, the less likely it is that they will become addicted later in life. Therefore, our goal as a community coalition is to collaborate with our partners to delay, decrease, and prevent substance use amongst youth. Permitting sales and consumption within our town limits will expose our youth and families to this drug on a regular basis. Webster will realize minimal financial benefit through opting in to permitting retail and consumption establishments. This sends a clear message to our youth, families, and all residents that Webster is willing to sacrifice their well-being for meager financial gain. Quite obviously, the less casual exposure that our youth have to substances, the better. WEN the FCC is thankful to have served the Webster community for the past 25 years and looks forward to positively impacting the lives of our young people for years to come. Thank you.
Thank you. Mark, I'm not going to get the last name right, so help me out, Mark.
My name is Mark Stock. I live at 731 Hill Spring Terrace in Webster. I'd like to speak on a couple points. First and foremost, I want to speak on medical marijuana. I know this is opting in and this and that, but I'll get to that point. At 7 years old, my daughter was diagnosed with brain cancer, had 3 brain surgeries, was in the hospital for 6 months, and she got prescribed medical marijuana. It helped her eat, helped her gain weight. And the reason why I bring that up is I'm a combat veteran. For 4 years, I spent 1 year in Iraq. Because there's discrepancies in between state laws and federal laws, the VA health system does not agree with the use of medical marijuana. So I use medical marijuana for myself because I have torn ligaments in both my knees, nerve damage in my back, insomnia, and PTSD. It helps me sleep, helps me everything like that. Whether you opt in or not, I'm still going to be going to towns and purchasing whichever town opts in. This isn't a moral dilemma. It's a matter of if we want to make tax money on this. I will be taking my hard-earned money and going to another town if you guys opt out of this. I'm speaking on behalf of, I don't know if anybody else here is a veteran, but I will speak on behalf of the majority of the veterans that I come across with that have these same issues. VA tries to prescribe me Oxycontin, Oxycodone, all those pills. I say no. I was getting addicted to that stuff, and so I opted out not to do that stuff because I know about medical marijuana. I choose not to get my card or anything like that because you can't. I'm a vet. So, and I have no other healthcare insurance or anything like that. So opting in, I think, would help benefit so many veterans. I went out on Veterans Day and every place was packed. I don't know if you guys try to avoid that day trying to go out to eat or not, but there's so many of us out there, and I know this will help out so many of veterans. We are going to be using it. And if you guys opt out, you can still grow in your own house. You can still carry up to 3 ounces on you. So it's not saying we're not allowing this in Webster anymore. Thank you.
Thank you, Mark. John Carrick?
John Carrick, 1155 Webster Road, Webster. I'm not a public speaker. I've been in Webster longer than most people have been living here. I see in the room here. So, over 81 years I've been a resident here. I've been a professional land surveyor for over 45 years, working throughout the county. I've been a health nut my whole life, trying to do the best you can with real food, no drugs, and doing the best you can. You know, keep your weight down, a bunch of other things too. I don't have all the facts on marijuana or this cannabis thing. I certainly think that it could help some people. I think it's better off having, you go to a doctor to get a prescription than to have the whole town legal for marijuana use. I think that marijuana or drug use in a town like this, or any town, is just it's too much of a problem for the kids. We're having too much of a problem with kids don't think right, too much alcohol, smoking. What happens if they get on these drugs? It's a tough thing. I can understand a real need when you're in real pain. I can understand that. The doctor's thing sounds good to me. I'm not sure how long you have to be in a doctor's care to get the thing prescribed. Are you there forever? Are you there for 3 months, 2 years, or what? But I mean, if it's going to help you stay sane without getting on anything else, it's probably a good idea. But I see there's no real reason to think that we want to go to option 1. I say option 2, let's not have it. 2, 3 years later, we want to opt in, fine. But once you choose to have it in, we can't get rid of it. I can understand why they're doing that. But once you have these stores selling a thing, you got to make a commitment to beef up your building and everything else. So I'm opted for the option 2 there, out. That's it.
Thank you very much, John. Joanne Nania?
Hi, I'm Joanne Nania, and my address is 764 Valley View Parkway. I want to just agree wholeheartedly with the presentation that this board was given by Ken Gregory at the last meeting regarding the medical marijuana, the marijuana dispensaries, and the benefit to Webster. I think that the argument about trying to keep marijuana out of Webster, away from our kids, it does not matter. Marijuana is here, marijuana is legal, and for Webster to pretend that by not having a dispensary in town that we can somehow protect our children, to me just doesn't seem realistic. It's impractical. We'll be able to drive across the bridge to Irondequoit for that matter, if that's what you really want. I agree with Mark. Marijuana is got the potential for so much good for people that have chronic pain, even certain illnesses that are well treated by marijuana use and with much fewer side effects than some pharmaceuticals. I just think that the town should seriously consider opting in because the town needs this tax revenue. All you have to do is drive around to any one of the dozen food pantries that are in this town to see how people are struggling. And if Mr. Gregory's estimate that 2.75% of the revenue from each sale of marijuana would go directly to the town, if that's even close to being accurate, that's a lot of money that this town government could help its citizens, its residents, by utilizing. Thank you.
Thank you, Joanne. Janine Contestable.
I signed in, I didn't sign the public speaking portion.
You signed in. but
I
not
just
to-
signed, no, I'm not speaking.
Okay, thank you, Janine. I'm having a problem with this one. Sue B.
Is it Sarah Brown, maybe? Sorry.
Sarah Brown?
Yeah,
Okay,
maybe.
Sarah S. B. How's that?
We'll go with it. And I had an old boss that called me Sue for like 10 years.
Now that I know you're Sarah, you're Sarah.
He was sweet, so it was okay. Hi, thank you guys for opening up this moment, even though I really give you a lot of credit for the research, the studying, the reading, the listening that you've done over the past few months. And even though you've done your due diligence, you're still opening the floor. I think it's a smart move to definitely hold off on on-site consumption lounges. There's a lot of issues with that. And I think, I have concerns. I have family members. So first of all, I work for the Smoking and Health Action Coalition, which is part of the American Lung Association. And I'm also here, we partner with WEN. And having asthma, when I'm driving down the road and I can smell marijuana emanating from another car, immediately I can't catch my breath. Right now, I've already taken 2 Benadryl today because I can't figure out what's triggering my breathing. So I think it's very important to do your research. So when we talk about opting out, we're not talking about opting out forever. I think that cannabis can be very beneficial to a lot of people. I wish it were for me. I overdosed on a quarter of a gummy. I was driving the car to the vet. I thought I was fine. I had waited 3 hours, and all of a sudden I'm like, I can't drive. So I pulled over. Luckily, my husband was with me, and I'm a lightweight. I don't know what my problem is, but it actually creates more pain for me. I have back pain, and I wish it helped. So I understand, and marijuana's here, like cannabis is here. It's legal. It's just whether or not we want dispensaries here. And I think, and it's really not whether or not we want dispensaries here, it's whether we want dispensaries here first, whether we want dispensaries here now, whether we want New York State to get their act together and give you regulations before you bite the bullet and say we're in, because once you're in, you are not getting out. You are not getting out once you're in. I just want you guys to understand there is no going back. If you take your time now, look at your tobacco-free outdoor policies. Where do you allow smoking? Anywhere you allow smoking or anywhere you didn't say there's no smoking, people can vape. I don't see people walking down the street with a bottle of alcohol. You will see people walking places with marijuana out in the open, and it's going to re-normalize tobacco. It's going to re-normalize smoking. People smoking, it's okay to smoke, Mom. These people are smoking, why can't I smoke? That's a whole other situation, but I think each town now, each municipality is going to have to take time to look at your code, look at what you have. Can people drive your vehicles in your town and vape if nobody else is in the vehicle? Can people, what will be allowed and what won't, and what is New York State going to regulate, and what aren't you going to have control of? You don't even know yet. So I look at it like a house. If I were going to, and like I said, I have family members who couldn't survive, couldn't sleep without cannabis. I have a sister in California. She can't sleep without it. I have another family member who just really has depression and anxiety, and it saved him. Again, it's legal, and just the dispensaries, do we want to be the first ones? Do you guys want to be the first ones? Are you ready for the potential fallout? There will be fallout. Like you said, you've done your research. There will be issues. There will be expenses. There will be those people that don't smoke regularly right now that have no idea what their levels are. The cannabis today can be up to 99%. If you're heating it, I don't have the language, that's not my area of expertise, but you can get, and if somebody takes that unknowingly, I mean, like for me, a quarter of a gummy, I don't, and I was reading an article on one of the leaders of ROC, what is the name of the organization? not Rock Normal. That person who has been a very experienced user even has her days where she smoked too much and she can't do what she was supposed to do that day. So,
Sir, I'm going to ask you to wrap up soon.
yes, I'm done. So it's your house, and I love the diligence that you've done, and thank you for listening.
Sir, thank you. Ken Gregory.
All right, Ken Gregory, 729 Hill Spring Terrace. Again, really appreciate you guys taking the time to understand this. I mean, you're left with a lot of unknowns at the state level. It's very easy to sit back and just say, you know what, let's let somebody else figure this out. So I really appreciate that due diligence on there. Couple of points to that. Waiting to opt out means that there will be no applications, opting out means there will be no applications submitted to the state listing a retail establishment in Webster. Meaning if you do decide 2 years from now, it doesn't mean you're going to get a retail establishment. I just want to make that clear on there. To address some of the overdosing when it comes to uses of product, if you're making a cannabis product in the black market, in your basement or your kitchen or your garage, there's no lab testing results. There is no idea having, what's in that product. And a lot of those concerns are absolutely valid. As Tom came and toured our facility, we have a chemist right on site to be able to lab test it, show exactly how much is in that product. We then send it to a third party, which is required under the MRTA to have it tested with most products do have a QR scan code. You scan it, it says here's the exact milligram that you're taking, so there isn't an issue if you don't know what's in that product. So it actually solves those concerns, it doesn't make it worse. The American Lung Association also blames the Valley outbreak, the pulmonary illness issues on flavored e-cigarettes. To where today both the FDA and the CDC recommend avoiding cannabis products from informal sources. Again, you have a situation where the legal, regulated, lab-tested market solves those problems. So it's actually surprising to hear you arguing against this when you think you want the products to be safe for the marketplace. In terms of permitting consumption, some of the when folks actually mentioned that as an issue, that's not even on the table. I mean, consumption is legal. I'm going to do it tonight. 100% in Webster. I mean, it's legal, it's here, it's not going anywhere. The issue is going to be whether or not we receive those tax dollars. Any questions, you guys, my information's out there. Please reach out, happy to clarify, but I appreciate everybody's time. Thank you.
Thank you, Ken. Jane West?
Sorry, Patty, I signed in as well.
Okay. Kate Zopkin?
Kate Zopkin, 600 Shady Glen Circle. I'd like to say so far that I like a lot of the points, both for and against opting out that have been made tonight. But a couple of points that haven't been made yet that I wanted to make. I'm in favor of opting out for right now as well. Because again, there's always the option to opt in later, but a lot of the things that have not been brought up so far is driving under the influence. So far, I think that our law enforcement is really going to be at a disservice because we don't have proper breathalyzers, proper testing for people that are under the influence. We haven't figured out what a legal limit is going to be. Obviously, driving under the influence happens, especially there are bars. When we're talking about the on-site consumption lounges, we're essentially talking about bars, right? But when it comes to driving under the influence, there are legal regulations, there's breathalyzers, there's tests that have been tried and true for alcohol and other drugs when you're under the influence. With marijuana, we're not there yet. There's a lot of tests that are coming up and being tested, but we're not there yet. And I think we're putting a lot of our police officers at a disadvantage when it comes to that. So from my perspective, I'd like to see us to opt out until we have a little bit more technology in terms of keeping our entire community safe. Because the last thing I want to see is someone get into their vehicle, go to a dispensary, purchase something, use in their vehicle, and then drive, and put our entire community at risk. Thank you.
Thank you. Amanda Grace?
Oh, sorry, wrong list.
Krista Gross?
Thanks. Wrong list, sorry, Patty.
Just sign him in. Julia Fisher? Steve Gaudioso?
My name is Steve Gaudioso. I live at 1077 Everwild View in Webster. It was not my intent to speak here this evening. However, listening to the comments back and forth I believe that we are in a situation of uncertainty. And a lot of that has to do with the lack of guidance from New York State. We also are missing a lot of data around things like consumption and driving. And I believe it's in our best interest to wait until we have better information. So I would prefer to opt out. Thank you.
Thank you very much, Steve. I'm at the end of the list that I have. I know some people came in late. Is there anyone else who wishes to speak? Please step up to the podium and give your name and address.
Hi, thank you. My name is Glenna Colapretti. I live at 440 Sundance Trail. I did not intend to speak, but as the gentleman just iterated, listening to the back and forth, I feel compelled to share my knowledge and limited expertise in this space. I am a current licensed New York State hemp grower and have been for years. I have grown in Lima, Penfield, and Central New York. I also own 2 CBD stores, retail locations. All of those are cannabis ventures. I have worked with thousands of people with pain, inflammation from 1 year old to 102. I personally do not imbibe with THC. I'm just super sensitive to it. I would probably have the same experience that you do. Albeit, I do support people's choice to do that in a safe manner. I do support it to be for people over 21. I have an 18-year-old who's in college and a 20-year-old in college, and I would not want them participating or driving, or my husband driving under influence. But I also would rather opt out, frankly, of opioid use, which I think has been much more devastating as a wider adage to, if you ever look at Monroe County FireWire and you look at the number of ODs, so if you look at the pharmacies that are in our locale, I love Walgreens, but I wish that they would opt out of opioid use as well. So I just wanted to add that. I'm also an adjunct professor at a college, and I teach regulations in cannabis cultivation. I firmly believe in compliance. I work with the towns that I grow in. I participate in third-party testing. I test every crop. I make sure it is not over the legal limit. I do an overabundance of third-party testing to any and all of my products. I have a wide array of products, whether it's topical, whether it is tinctures, whether it's beauty cream, eye cream, face cream, all of those are cannabis products, to be clear. It's one plant. It is a difference between a certain percentage of THC. I do believe that as residents, you have the right to your opinion, but fiscally, if you do opt out, you will miss out. Most definitively, probably on those initial licenses for participation in this space. Once people deem that they want to open up a dispensary, they will go to a town that is opted in and supportive of that. And if I may, I would just like to read a few aspects of some research. And feel free to, cut me off whenever you deem
Got about a
necessary.
minute and a half.
But there is a 4% local tax that is split with 25% going to the county, 75% going to the locality. The MRTA enacts a 9% state excise tax on that retail sale, with 40% of those proceeds going to social equity programs, just like the ones that you guys lead. Again, it's for people over 21. It is an adult consumption, an adult sale. There will be a strict requirement by the state. I'm also on the committees for New York State cannabis growers, and we work with a lot of legislators. I've met with a lot of legislatures locally and our state senators. We fully intend to support that. I, in turn, intend to grow cannabis, but only work with people that comply and do not increase the sale of drugs to kids. Another aspect that I wanted to address was that legal cannabis does not make it more likely that minors will imbibe. JAMA Pediatrics did a study that showed that legalized recreational cannabis was associated with 8% decline in teens. If they are going to imbibe, they will drive to the other town. They will call for a delivery. You cannot opt out of growing it or delivering it, just to be clear. There's also a great CDC's youth risk behavior surveillance system study that showed that legalization had no impact on marijuana use. They are going to use it if they're going to use it. I'm not saying that I would want people walking down the street smoking pot by the school are smoking marijuana. I'm saying for a legalized, compliant industry, if we can discern that from the concern of the moral turpitude and the usage amongst kids. None of us want kids participating in drugs or impeding that. I just want to be very clear with
Glenn,
my
I have to
comments. And one last thing, if I may.
Wrap up some, please.
I do believe that as a group, we could come together and look at the medicinal aspects that are there and do support that people go to bars, they do imbibe in things that are harmful per se, but if you do it in a compliant manner that benefits the town, I ask that you opt in. So, with
Thank
that,
you, Glenn.
thank you very much.
Is there anyone else who would like to speak? Step right up, we'll need your name and your address, please.
Okay, I'm not here to speak about that, but I will say a couple words about it. I wanna
If
talk
you'd like to
something
speak
else.
about it, step right up to the podium.
Go for it, accident. My name's Dave Milwaukee. I live at 563 Galbro Circle. I've been here before. Last time I was here was on April 15th this year. You may remember. I was here to talk about the Runquid Bay Outlet Bridge.
Move that mic up, that helps you start.
And I'm
Yeah.
sorry, there you go, can I get your name again?
Sure. My name's Dave Milwaukee. M-A-L-E-C-K-I. 563 Galbro Circle, Webster, New York. I was here last on April 15th this year. I was here to talk about the Runquid Bay Outlet Bridge. The supervisor at that time said he'd talk to me about it. I haven't heard back from him. Yeah.
And did you want to speak about the public hearing for the marijuana?
Yes, I can.
Okay.
All right, so the reason why I use the Runquid Bay Outlet Bridge is I'm an avid cyclist. Okay. And the young lady who talked about the concerns with driving while impaired, I have that. I don't want someone running me off the road. I don't want someone killing me or injuring me. But my main complaint about the Bay Bridge the way it is now, the Runquid Bay Outlet Bridge, is it's seasonal.
I'm sorry, but I have to stop you because this portion for comments is only on the marijuana sale. But you're welcome to stay and speak more if you open to the floor if you want to talk about the bridge.
Oh, certainly. Is it okay with you if I speak now?
But I'm sorry, I can't do that with a public hearing. We want to hear what you have to say, but if you can hold on for a little bit while, we'll open it up to the floor.
Sure.
Thank you so much. Is there anyone else who would like to speak about the sale of opting in or opting out of marijuana? Okay, seeing none, I will close the public hearing. I want to thank all of you for coming tonight. As you have probably seen on the agenda, this is not something we're going to be voting on this evening. We want to take into consideration what everyone has said. We are still doing our due diligence on this, and we will be voting on this at a later date. So thank you all for attending. Thank you.